Company. I want to welcome everybody to the Secure Advantage Hospital webinar. Got some things I think can help you, our agents, make a little bit more money out there in the sales field. And as we go through this, I have one of our top marketers, Gershon Georges, on the other end of the webinar. She will take your questions. You can type them in as we go. If you have questions, she will try and answer them as we go through the webinar. We'll try to have you in and out of here in about 45 minutes. And she will be able to answer most of your questions, and then at the end we'll open this webinar back up to questions so that we can read those back and everybody can get their questions answered. So again, thank you for joining us, and let's go ahead and get started. I want to show you a map of where this product is available. I think there's about 21 or 2 states on there altogether. We also have another offering on our sister company, Equitable Life and Casualty. The owner of Heartland is also the owner of Equitable, so we have separate papers. Equitable's licensed in 44 states. So if a state that you market or sell in is not in green on the map right now, give us a call after the webinar and we will let you know if those states are available. So we have a total of about 44 that we can get this product in your hands. One thing you will notice when you, I think with the exception of Colorado, if you were selling the product in Nebraska or South Dakota, which is right above Nebraska, there is absolutely no difference in the prices and benefits. They are pretty well standard. Some states make us do a separate filing to add benefits as you go, but primarily it's a package type of product. So if you have any questions on availability, for sure get in touch with us. If you don't see a green state on the map, we will get you set up so that you can market this product. Another thing that I will tell you as we move forward in here, the Medicare Advantage season is just around the corner, and this is a product that a lot of our agents add to Medicare Advantage sales. We will cover that here shortly and try to show you some good ways to where and give you some good marketing ideas and sales ideas to where you can add this to the Medicare Advantage product. So let me tell you a little bit about why we developed the Secure Advantage product line. I started selling Medicare supplement insurance in 1984, and by the way, that's a long time ago. It's about 29 years ago. And we wrote a lot of Medicare supplement. We wrote a lot of final expense. And long-term care hadn't even hit the market, but it came on about a year or so after that. So that's where my background came from. So I got to see how the original Medicare line worked, and then wasn't too long down the road, and back in about 2005, we started hearing rumblings of a product called Medicare Advantage. And as a salesperson who had built many, many years of Medicare supplement renewals up, I'm thinking, holy moly, I'm going to lose everything I've worked all my life for. But what we found is when Medicare Advantage did hit the market, it created more opportunity instead of causing us to lose what we had worked for. So there were a lot of good opportunities and a lot of good reasons to be in the senior age market. And that's one of the main reasons why this product was developed, was for add-on with a Medicare Advantage. So where the product fits primarily, as we said, is a Medicare Advantage plan. We see some guys adding it to high deductible Plan Fs. Not a lot of that out there, but there are guys out there that will add it to a high deductible Plan F. And we see some guys adding it to people who are getting late in their, kind of like in my situation, I'm 60 years old and my major medical premium is now starting to spike. So I got about a little over 4 years before I turn 65. And I know what's going to happen. I've seen it happen to my clientele over the last 29, 30 years, is once they get into that 60 age group to 65, you're really in no man's land as far as what happens to your premium. So a lot of folks will take maybe a $1,000 deductible and raise it to 5, or maybe a 25 and raise it to a 10, and we see that saves them a lot of money in premium, and then the agent will come by and offset that with a hospital indemnity plan and still be saving the money, but offsetting some of that risk they take on that, raising the high deductible up. So it fits there, but primarily, as we talked, and for this webinar, we want to talk about how it works with Medicare Advantage. So I always challenge agents on this webinar to, excuse me, to call a major hospital in the area in which you live and ask to speak to the department that handles Medicare billing. And especially when we're getting closer to Medicare Advantage season, you'll start, when you ask that Medicare biller, say, well, what plans are you taking? And a lot of times they will refer back to you as, are you referring to a Medicare replacement product? Well, stop and think about what they're saying to you. We are not really replacing Medicare, but we are taking them out of original Medicare A and B and putting them in Part C of Medicare with a Medicare Advantage. Now, why do people buy Medicare supplement insurance? They buy a Medicare supplement to supplement Part A and B of original Medicare because it has deductibles, co-payments, and co-insurances. So if we're taking them from original Medicare and putting them in Part C of Medicare, doesn't it make sense to you and I as salespeople that Plan C or Part C also has deductibles, co-payments, and co-insurances? When Medicare Advantage first hit the market here in the Kansas City area, the out-of-pocket maximum was about $2,000 to $2,500, depending on which product you were looking at. Well, those out-of-pocket maximums have now went from the $2,000 range to as high as $6,000 and $7,000, depending on, again, the product in which you're selling. And the co-payments have changed to where not only is the out-of-pocket maximum higher, now the companies are finding ways to help you get there quicker. So I went to a conference in Columbia, Missouri the other day that Dan McNerney's shop had put on, and there was a lot of talk about in 2014 with Obamacare that these Medicare Advantage plans are going to have to mandate the claims loss at 85%. In other words, the mandatory claims ratio is going to be set at 85% on the claims loss. So if that happens, that's going to also affect benefits, I think, in 2014, 2015. So it's going to be interesting to see what the benefits are here. They should start being filed with CMS around July. That's when most of these companies like United Healthcare, Coventry, Aetna, and all of the companies that participate in the Medicare Advantage market, when they start filing their products for approval for the October 15th release date. So this is really where the product was designed, is in the arena of the Medicare Advantage product. Now, what we will spend the last part of the webinar in is talking about a presentation that if I can get you to do it, kind of like the way we created it here, is it'll make you effective about 6 to 7 times out of 10 that you present this product. So in today's economy, a lot of times agents will say, is this type of product affordable? So what I did is I just I went ahead and created some examples of what's in it for you, the agent. And what I come up with is I just took a sample rate for a 65-year-old, $200 a day on the hospital confinement benefit, and I threw a lump sum $10,000 cancer rider in there. So what I came up with was about a monthly premium on an average of about $62, which would create somewhere in the yearly commission range of about $452. And if you just put a pencil to that, if you just wrote 2 of these a week, you're going to create yourself another $45,000 in income. Now, to me, that's still a pretty good, addition of raising my income. And again, I'm not trying to get you to change what you're doing. Just take a look at maybe how this product could help increase your sales and make your clients a better, more rounded product if they're on a Medicare Advantage plan. And then, what I want to do at the end of the webinar, again, the last half of it, is show you how to present this Secure Advantage product. It's about a 6-minute to 10-minute presentation, depending on your conversation with the client. But one of the hardest things that you and I have when it comes to cross-selling is, how do I get from point A to point B? In other words, how do I get from the Medicare Advantage to the Secure Advantage hospital plan? I have a transition phrase. It's about 6-7 lines. If you will remember this transition phrase and use it how I show you, it flows so well from the MA to the Secure Advantage plan. So let's first take a look at how the Secure Advantage product works out there And we basically have 3 benefit levels, and primarily for today's webinar I'm going to talk a lot about the first one, the silver. We have a silver, gold, and a platinum depending on the state in which you are in. If you are in Florida, we only offer the gold and the platinum, and the gold is not a 20-day, it's a 31-day benefit period. That's the way Florida made us file it, so we didn't have any choice in how we filed there. We had to do what they recommended. Okay, so the silver benefit. I'm going to talk a little bit about this product. I'm going to talk a lot about this product, but I want to spend a little bit of time explaining the differences between what we do against what maybe some of the competition is doing, and what we have done to eliminate any bad recourse for you, the agent, when it comes claim time. So start out, the daily hospital benefit on this plan is a 10-day maximum benefit period. Most Medicare Advantages you're going to find are days 1 through 7, so you got enough coverage here to, if they're in there and they max out their MA plan on the hospital side, you got this to fill in, and if they're there more, we continue to pay because this is an indemnity plan. So let me give you an example. The Coventry program that's very popular here in the Kansas City metropolitan area has a 1 through 7 day exposure in the hospital. Well, if they're there 8, 9, and days 10, we continue to pay whatever benefit that you paid, even though Coventry stops at day 7. So that's what indemnity means. Whatever they buy is what we pay. So it's a 10-day maximum benefit period. You can go anywhere from $100 to $500 in $50 increments. And what I would like to do is explain to you what a period of care means on this plan. It simply means that if 30 days separate their discharge date, in other words, the day they got out of the hospital, if they go 30 days and then re-enter the hospital, we start out at day 1 again. So I'll give you an example. Say they were in the hospital for 5 days and they were only out of the hospital 2 weeks. Then they would start out at day 6 and go through up to 10. But if they were in the hospital for 5 days and a month went by or 2 months went by or 3 and they went back in the hospital again, at that point on that example they would start out at day 1. So we have to have 30 days separate 2 periods of care, and they start out with a new benefit period. Most of the competition that you look at will be 60 days. So that's a good selling differential for you, the agent. Gives your client a chance to draw more benefits quicker. The durable medical equipment is a $200 per occurrence per calendar year. You know, anything that's considered durable medical equipment is what we pay on that. If they leave the hospital with oxygen, they get a $200 benefit for that. If they leave the hospital and they have to have a cane, and the Medicare allowable is $100, we still pay $200. Whatever they have for durable medical equipment, this plan pays $200. The ambulance bill. Most co-payments on an ambulance, I believe, is $150. We only pay $100 on this plan. However, the ambulance is going to take them to the emergency room, and the emergency room copay is $65, and we pay $100. So they're going to get a bill for about $215. We're going to pay $250, and those benefits will always coincide with one another. The ambulance doesn't take anybody to Walmart; they take them to the hospital emergency room. So back to back, you're always going to have enough benefit there to pay those 2 benefits. Then the last benefit down there is the physician's benefit, which is $25 with a calendar year of $75 maximum. When I'm selling, I underline for follow-up after a hospital stay. I blacken under that. I'll write 4 or 5 heavy lines underneath that so that they for sure see that that is for a follow-up after a hospital stay. If you've ever been in a hospital or had a loved one in the hospital, when the doctor makes his final discharge or final round, in other words, he's getting ready to discharge you, one of the last things he will say to you is, you know, Bill, I want to see you back in here next week on Tuesday to make sure you're still doing okay. So that's a follow-up visit at the hospital from after a hospital stay. Then you also have an optional lump sum cancer rider that's from $1,000 to $10,000, and you can do that in $1,000 increments all the way up to $10,000. So you can write 1, 2, 3, 4, 5, 7, 8, or 10, whatever you want to write, you can. And I see a lot of applications come in without the lump sum cancer rider on it. And to me, we are not doing our client a big service, and we're not, you know, we're missing out on income for you and your family guys, gals, stop and think about cancer in this country. 1 in 2 men over age 65 are going to develop cancer sometime in their lifetime. 1 in 3 women, once they go over age 65, are going to develop cancer sometime in their lifetime. To me, all you got to do is ask somebody if they know anybody. Has cancer ever affected anybody in their family or circle of friends? Get them to talk about it. Once they start talking about it, then you know there's a good chance that if they haven't had cancer, that there's an interest there. They know people that's had cancer. So let me give you an example of how I add this and what I did for a client. Just, it's been close to a year ago now, but I just use this for the webinar examples. I sat down with a guy who was a referral from his mother. I'd had her insured for a lot of years, and he was 64. And kind of like the example I was giving you earlier about where people use this product, he was 64 years old, getting ready to turn 65 in the next 30 days, and he was paying in the neighborhood, I don't remember the exact number, but he was paying in the neighborhood of around $450 a month for his major medical. I'm 60 and I'm already paying $350 a month, and I got a $2,500 deductible. He also had a $2,500 deductible and coinsurance to $10,000. So I sat down with him. He wanted a Medicare Advantage like his mother, so I wrote him the Coventry program in Kansas City, and all of his doctors were in the network. The hospitals were well represented, so that's what he wanted. So I wrote him a $300 a day benefit on the silver benefit plan. So he had a $300 a day benefit for the daily hospital. He had the $200 for the durable medical equipment. He had the $100 for ambulance and the $150 for the ER. And then I said, you know, for another $29 a month, I can add a lump sum cancer rider of $10,000 to this. Well, he kind of hesitated right there, and he said, do I have to make my decision today on the cancer rider? And I said, no, you do not. I said, but before you make that decision, let me give you some information to help you better make that decision. So I give him the example, you know, 1 in 2 men age 65 have a 1 in 2 chance of having cancer sometime in their lifetime. So I'm a big legal pad guy. I took my legal pad out and I handed it to him, and I said, I'll run the calculator, you run the legal pad. I said, so take 29 times 12 and I'll give you the number. So he took 29 times 12, wrote it on a paper, drew his line underneath the 12, and I said, that is $348. And then I said, now take 10,000, right out there on the side of that, take 10,000 and divide that by that $348. Well, if you guys do that, you'll come up with 28.6, 28.7, something like that. So for him, I said, just round that up to 29, about 29. So he wrote 29 out there, and I said, now do you know what the 29 represents? And he said, well, not really. I said, well, the 29 represents how many years you would have to pay that $348 a year for this rider for the cancer to equal how much we would pay out. I said, with a 1 in 2 chance of you having cancer between now and the time you turn 94, the next 29 years, I said, with a 1 in 2 chance of having cancer, don't you think that this might be something you should consider? I seriously believe it's in your best interest, don't you? He said, you know what, I've never thought about it like that. He said, let's just go ahead and do it. So all I did was break it down to the ridiculous. I took what he was paying, divided it into the benefit, and when he seen it in that light, he realized there's a lot of value there, because he had already told me, you know, in our warm-up period that I'd always ask about cancer, that there had been some cancer in his family. So I knew this was an area that he should have interest in. Everybody should have interest in this as much cancer as there is. My oldest daughter had a malignant melanoma cut out of her shoulder about 4 years ago, coming up on 5 years without any reoccurrence. So, you know, it's affected my family. The owner of our company, his fiance's had breast cancer. So you can talk to anybody about cancer. I guarantee you they're going to have somebody they know, either in their family or circle of friends, that has been affected by cancer. Now, before I move on, I want to go back and show you some other differences in what we do for you, the agent, so that you don't have to get an angry client on the phone telling you that the plan you sold them is not any good. The emergency room, if you look at the emergency room benefit, it says $150 per emergency room visit following an accident or an injury. We have refiled the product. We should have the new language out there soon, but ever since the beginning of this policy, we just forgot to put sickness. We said accident or injury. Well, to me, accident and injury is the same thing. What we meant to have there was accident or sickness. We are paying for accident or sickness regardless of whether they are hospitalized or whether they are not. If they go to the emergency room 2 years from now, you think your client's going to remember, well, I forgot I had to be hospitalized for that to pay, especially if the ambulance picked them up and took them to the emergency room. They're going to expect some form of payment. Or they're going to call you and tell you, you know, this plan's not any good. So what we did is we sat down and instructed the claims department, if you get a bill for an ambulance or an emergency room and it's for sickness or accident, whether they're hospitalized or whether they are not, pay the claims. And guys, this webinar is coming to you from the vice president of the company, so I'm not just, you know, a guy we picked out to give this webinar. I'm telling you, as the VP of the company, we will pay your ambulance, your emergency room, if they go in the hospital or if they don't, and we will pay it if it's sickness related. We're going to pay it. We want you to be covered. Go back up to the daily hospital benefit. Let me give you an example. Let's say the ambulance picks up your client. They take them to the emergency room. I'm going to give you a couple different scenarios here. And in the emergency room, your client was having chest pains. That's the reason for the ambulance call. They took him to the hospital, and the doc runs all these tests on him. And he says, well, Bill, you know what? I've run these EKGs, and I've done a bunch of other tests here. I don't see anything wrong with your heart. I'm going to go ahead and send you home. The competition, and I use GTL a lot because they are a really good company and they got a good product out there, and all I'm doing is explaining the differences between the two plans. Guarantee Trust will not pay that claim because you were not hospitalized. And number two, you went to the emergency room for a sickness. They don't pay for that. They only pay for accident or injury. We will pay that claim. Let me take it one step farther. The ambulance comes and gets your client. He's having chest pains. They take him to the emergency room, and the doc sits down with you and he says, okay, Bill, he said, I'm 100% sure you're not having a heart attack, but he said, I really, really want to make sure that I don't miss anything. I'm going to go ahead and put you in the hospital overnight, and if you're okay in the morning, no problems during the night, I'll send you home in the morning. Now, if you sold a hospital indemnity plan to an individual, and this happens a year, 2 years later, and the doctor says, Bill, I'm going to put you in the hospital overnight, what does your client think? They think they're in the hospital, and they're going to file a claim, and they're going to get a denial letter from Guarantee Trust because he put them in the hospital as an observation bed. We will pay for the observation unit also. So if you wrote $500 a day, we would pay the $500 they were there that day. We'd pay the $100 for the ambulance and $150 for the emergency room. We would send out a benefit check for $750 versus a denial letter from the competition because they were not admitted to the hospital. They were only an observation patient. Guys, they can be in an observation room a couple of days, and I'll tell you what, you have a really, really angry phone call if you wrote a policy on somebody and they were there a day and a half in the hospital and got no benefits from the company. So we've eliminated that. We want you guys to rest assured that that policy will pay those claims and that you don't get that call from the client saying, hey, Bill, that policy you sold me is not worth the paper it's wrote on. And by the way, I'm canceling it, and I sent you to my brother and my sister, and I'm going to call them, tell them they need to cancel it also. So we've eliminated that from your block of business. We're going to pay your claims. We're going to keep your clients happy, and that way you keep business on the books and you still generate that residual income, which is why we're in this business, is to create a residual income. So, have any questions on that? You'll have email addresses and telephone numbers at the end of the webinar. Feel free to get a hold of us, and I will go over it with you. Just while we're on this real quick, we also have filed two more riders for this plan. One's going to be a surgery rider, and I'm pretty sure it's inpatient, outpatient, and then also the skilled nursing unit, which a lot of people have been calling for from the sales field. So those two riders are filed, and when those two riders get approved, you will find the new current language stating we pay for the observation unit, we pay for accident, injury, or sickness, regardless of hospitalization. So rest assured we're going to take good care of you guys and better care of your clients. So any questions, get those to us at the end of the webinar. The gold benefit, I'm going to kind of bust through here real quick on the gold and the platinum, because I've talked a little bit more than I should on that other, but I think that's important for you guys to know how the program actually pays out for your client. The gold level is a 20-day maximum benefit period, again in $100 to $500 benefit levels, $50 increments, so you can write 150, 200, 250, and so on. The durable medical equipment's an additional $100 for up to 300. The ambulance is 150, and the ER is 200. And again, regardless of what the MA plan pays, those are indemnity type benefits. So if they end up there, what you see on the screen is what they get. You also have your, again, follow-up after a hospital visit, the $25 per visit. And then you also have your option to add the lump sum cancer rider in $1,000 increments all the way up to $10,000. Okay, the platinum, we don't see a lot of this coming on, but we do see every now and then somebody will write a 90-day maximum benefit period. The benefits are just a little higher on this plan. You got the $400 for durable medical equipment, $200 for the ambulance, $250 for the emergency room, and your two benefits at the bottom, which are the $25 visit for a follow-up hospital stay and your optional lump sum cancer rider. Okay, move into the app. It's a very, very simply written application. Section 1 is all the personal information, where we ask about the name, date of birth, street address, or male, female, their age, and telephone number. You go down to Part 2. We're going to ask you to check one of those three boxes in the upper left-hand corner where it says silver, gold, or platinum. Make sure you pick one, not 2 or 3. Will this policy replace any other accident insurance? Generally, that's no, but if you do replace another HI program out there, you would check yes and fill out the replacement form as required by each state Department of Insurance. In the middle, you see hospital daily amount. That's where we need you to write, did you sell 100, 150, up to 500? And then on the first occurrence cancer rider, did you add that to there? I'll give you another example of why that cancer rider is important. People who go through Medicare benefits and they get a standalone drug plan, or maybe it's built into their Medicare Advantage plan, when they get to the prescription drug benefits, you'll get into your specialty drugs, which a lot of that is a Part D, as in David, charge. When you get to your specialty drugs, a lot of times it's as high as 33% co-insurance. Well, what that's going to happen if it's a cancer drug, that's going to push them through the donut hole real quick. So they're going to spend about $4,700 out of their pocket in true out-of-pocket cost. Even if you put a $5,000 cancer rider on there, you can explain to them why they need that should they get cancer. It will help offset the pain of going through the donut hole to where they hit catastrophic limits. So that's another good reason for why they should add at least $5,000 of cancer riders to these programs. Okay, just going to cover a couple of things here in the application itself. It's a yes-no application. Guys, gals, make sure you do a good job underwriting. Ask questions. We don't follow up phone calls on this. We don't do any underwriting up front. We're depending on you to be our eyes and ears, but don't think you can slip one by us, because when a claim comes in, we'll do an MIB hit, and if it shows up that they've been on oxygen for the last 10 years and you check no on the oxygen question, that's going to cause a problem, probably get the policy rescinded. Do not try to pull that. We've had a couple agents, not a lot, but we've had a couple of guys try to slide things by and didn't realize there was an oxygen tank, and they had COPD, and they were insulin-dependent diabetic, and about 5 or 6 other health conditions in there. So make sure when you go through here, ask the questions. And question number 1, it says, in the past 2 years, have you seen a physician, been diagnosed, treated, or taken medication, or been advised to have treatment, surgery, or take medication for internal cancer, leukemia, melanoma, Hodgkin's disease, or lymphoma? If they say no, check no. But if they say yes, you know you can't sell this policy. So let's say that you ask that question 1A, and when you say, have you had internal cancer, and they say, well, about 5 years ago I had a malignant melanoma, kind of like my daughter did, on her shoulder, cut out of there. Well, they could truthfully, if they're not on medication for that, which they wouldn't be if it was melanoma, they could answer that no. So you can proceed to question B and C, D, and go all the way down through that. When you come to question C and you say, have in the last 2 years had any treatment for congestive heart failure, one of the things I always ask, I said, well, are you taking any type of drug like Lasix? Lasix is a drug that is widely used for congestive heart failure. If they say, well, yeah, I'm taking Lasix, but I don't think it's for congestive heart failure, pick up the telephone and get their nurse on the phone and have them ask that question. You know, what is she taking Lasix for? Is it in regards to blood pressure and just to remove fluid? Yeah, that's it. Or is it because they have congestive heart failure? You know, if you don't know while you're sitting there talking to them, now is the time to ask. Complications from diabetes. If they're on insulin, make sure they don't have neuropathy, which is tingling in their fingers or their toes. Make sure they don't have any kidney or eye damage because of the units. If they tell you, yeah, I'm on insulin, I'm taking about 55 units a day, don't try to slide that past. We will catch it. Just say, I'm sorry, you're not going to qualify, and move on to your next opportunity. But if all of this is no, 1A through H, then you come down to question number 2. And now we drop back to 1 year. Okay, so in number 2B, it says, have you been hospitalized 2 or more times in the last 1 year, or been advised to have surgery that's not yet completed? So maybe they say to you, well, Bill, I was in the hospital about 6 months ago. I was out here at St. Luke's East. I had pneumonia, and I was there 4 days. Bingo, there's one. And then the next statement is, and about a month before that, I had been out there, and I had cataract removed off my left eye. Bingo. In the client's mind, there's 2. They don't think they're eligible. But you and I know what they just told me the cataract removed was completed as an outpatient. So I explain that to them, and I don't miss a sale there because I'm being thorough asking the health questions. So make sure when you ask 2B and they say, yeah, 2 or more times, make sure it's 2 legitimate hospital stays, or maybe they don't have their dates wrong and one was more than a year and the other one was within the year. So make sure that you do a good job and don't miss a sale just by taking their word for it. Now, go back up to question 1A in the last 2 years, have you had internal cancer? And I used the example of 5 years. Well, if they could go ahead and answer all the questions 1, 2, and 3, no, they can still apply for the base plan, but what they could not do is apply for the first occurrence cancer rider, because on that we ask in the past 10 years, have you been diagnosed as having advised to seek treatment or receive medical treatment for internal cancer. So they could still get the base policy, they just could not add the cancer rider. However, if they tell you, well, it's been a little over 9 years since I had cancer, this is 2013, if they say back in July of 2013, I had my last treatment for cancer. So you know now you're getting real close to that 10 years. You can do one of 2 things. I would write it now, come back and add the cancer rider if they wanted it, which I would think somebody in that situation would definitely want it. But you just couldn't do it right now. You got to wait till they're 10 years outside that treatment date. And the reason I say why I would do it now is because what would happen if they had been in the hospital once, and between now and the time you came back, they went in the hospital again? Then they couldn't get the base plan. So at least you can get the base plan in the house and then come back and add the cancer rider. So just a little food for thought on the health side. Make sure you do a good job of underwriting, ask the questions, and everything will work just like you want it to. Okay, move on to the premium payment. Very simply put here, if the payer is not the applicant, you have to fill this out. Doesn't happen very often. If the payer is the applicant, you can go right on down to, you don't need to put anything there. You can go right down to the initial premium paid, and you have to pick up a one-time policy fee of $25. We have 3 direct bills available, annual, semi-annual, and quarterly. The only way we accept a payment on a monthly bank or on a bank draft is monthly. You see where it says 2 months monthly bank draft? Right above there, right there. I'm going to move on to that. We only require you to pick up 1 month's premium plus the policy fee initially. We will not pins your business. We will issue the business if you pick up 1 month. And the $25 can be included in your first check. We do not have to have a separate check for the $25 policy fee. Okay, then you want to move right down to renewal. Do you want a direct bill on the annual, quarterly, semi-annual? That would be, you check direct bill. On the bank draft, if you're doing a bank draft, you can check checking or savings, and you can put in the 9-digit number or just include a void check. We'll do all that for you. And be sure when you come across to the right-hand column where it says select bank draft day, discuss that with your client. Let them know what day they want that money to come out of their checking account, and then make sure you check I authorize the bank draft payments, and the bank name and the name of the depositor. Now, if you have any special request, if you look right above the select bank draft day, there's an open area with no barcodes or anything on it, big white area there. That's where you need to write any special instructions on billing. This is June the 3rd, and say my client wants me to make this effective July the 1st. Maybe they had a GTL and we're replacing it, and they've already paid for June. So right there, if that's what they want you to do, make effective July 1, 2013. Do not draft until July the 5th or August the 5th on the bank draft day. Draft on the 5th. Or maybe they don't want you to cash that check until July the 1st. Right there. Do not cash check until 7/1. That way it's on the app, and if we miss it, we'll refund it. If it causes them a bank draft, we would pay the bank draft fees. But if it's not there and we don't know what you want, then we hold no liability. So make darn sure that if there's any special instructions that you write it right there above select the bank draft day. Okay, that is the application. What I want to talk about now is a lot about the scope of appointment form, and then I want to move into the presentation of how to present the product and get the questions out there, and we'll let you get back out to work. So the scope of appointment form, there's always a lot of controversy out there about cross-selling, that you cannot cross-sell this product with a Medicare Advantage at the time of sale, and that is not correct. You can sell this at the same time if it's disclosed on the scope of appointment form. If you're working with a company that requires their own scope of appointment form, and this is not on there, what I tell my agents to do is use the company specific if they require it, and then have this one filled out also, because it does disclose the scope of appointment form, and you keep that for your records. Send a company one to them. Now, this form was approved June the 12th of 2012. That's why I popped that out there. It says that on the very bottom, but I wanted you to see where it says that. I've been using this exact, well, it's a little bit different, laid out a little different, but I've been using a form almost identical to this ever since 2010's enrollment season. So when you do your compliance, and by the way, we all got to know that the MA compliance is coming up here real quick. God, I love that time of year, as I know you do. When you do your compliance, it says right there in the cross-selling, it says that cross-selling of any non-health related product is prohibited, such as annuities or life insurance. You cannot sell annuities or life insurance at the time of sale. But if you look at your 5 options here, you got your standalone Medicare prescription drug plan, your Medicare Advantage plan, dental and vision, hospital indemnity, Medicare supplement. I just tell my client to, if you're unsure but you think you might want to talk about these when I send the scope of appointment out, I said just initial all of them. That way we're covered. We can talk about anything that you want to talk about. And they do that. So that way you are covered should you ever have a complaint, as you know that can happen with a Medicare Advantage plan. So that's how I handle the scope of appointment form, and I sometimes use this one standalone, and sometimes if I'm using a company that requires their own scope, I'll use both forms. Any questions, call us on that. Okay, now, guys, from here on, we're going to talk about how I present the product, whether I am out reviewing somebody who has a Medicare Advantage plan, maybe they've called in and they want somebody to come out and talk to them, or whether I'm selling a brand new one on turning 65, or they're aging in, or they have an SEP. Doesn't matter if I'm selling Coventry, United Healthcare, Humana, any universal product out there that sells Medicare Advantage, the summary of benefits, which is what you're looking at there, is a summary of benefit. They are all standardized. When you come to number 3, they're going to talk about inpatient hospital care. In your center column is going to be what Medicare does, how original Medicare works, and the following side on the right-hand side is how that particular plan corresponds with inpatient hospital care. Now, you remember I'm a big legal pad guy. When I go into reviewing their summary of benefits, or whether I'm reviewing or presenting a new program, when I come to number 3, I have my legal pad out, nothing on it except I have written you pay, and I underline the you pay column that I want laid out on my legal pad. Sometimes I write on the you pay column, and sometimes I just turn it around and have the client write on it. And I'll say, well, Mr. Jones, if I have him do it, I'll say, this is the you pay column, so as I go through these benefits, I want you to write these numbers down. So when I come to number 3, which is the inpatient hospital care, I simply say to him, if you're in the hospital days 1 through 7, you're going to be required to pay $250 per day. Now, Mr. Jones, what that means is if you're in the hospital for 7 days, you are responsible for $1,750. Now, I say to him, now, Mr. Jones, don't let that bother you. Don't worry about it. I'm going to show you why you're not going to have to pay it. Now, don't let me forget it, okay? And then I tell him to write that $1,750 in the you pay column. And then I move on through the summary of benefits until I come to number 14, which is the ambulance service. Again, doesn't matter what company I'm using. I just used Advance for Freedom on this because it's a very popular program where I'm at. When you come to 14, it will say the ambulance services, and it's going to say that you're going to be required to make a $150 copayment should you be in an ambulance, whether it's air or ground. I move right on to number 15, which is the emergency room. And I tell him if you're in the emergency room, you got a $65 copayment for any emergency room visit. Now, I come back to my statement. I say, Mr. Jones, don't worry about the ambulance copayment or that emergency room copayment. Again, I'm going to show you why that's not going to affect you. I'm depending on you not to let me forget it. And I move on until I come to number 18, which is the durable medical equipment. All of these are benefits of this plan. And I tell him if you're in the hospital and you require durable medical equipment, I said Medicare and most Medicare Advantage plans are going to require you to pick up 20% of the cost for Medicare covered items. By the way, I also have him write the 150 and the 65 under the 1750. And then out to the right of that, I tell him, I said, let me explain how this works to you. I said, let's say you're in a hospital and you're going to come out of there and you got to have a walker. Say the bill for the walker is $1,000 and Medicare only will allow or only cover 20% of it. So I take $500 and I write it on the paper. Out to the left of the $500, I write $1,000, which is the actual bill, and I ask him, I get him to participate with me. I said, now you're going to end up paying 20% of one of these two. You think it's the actual or what Medicare actually allowed? And of course, I've already given him the answer. So he says, well, yeah, the 500. So I take 20% of $500. That comes up to a $100 copayment, and I draw that, and I take him and I say, now put that right under that $65 emergency room copayment. And I draw a line under it, and that means he's come up to about $20,000 or $2,070. But before I do that, after I draw my example, I say, now, Mr. Jones, again, don't worry about that. You're not going to end up paying for that. I'm going to show you why you don't have to pay for that. And then I move clear through the summary of benefits. I go through the durable or the prescription drug benefit, and when I get done with the prescription drug benefit, I simply fold that summary of benefits shut. I pause and I look at Mr. Jones and I say, now, Mr. Jones, that's how your current program works. Have you got any questions? Well, I've reminded him not to let me forget 3 or 4 things during this presentation. What do you think Mr. Jones is going to say at that point? Almost invariably they will say, well, yeah, Bill, you were going to show me how not to have to pay all those charges. He may not say it exactly like that, but he will remind you, because I've reminded him not to let me forget it. So he will say, yeah, you're going to show me not to have to pay all those charges. And I thank him, tell him that I was getting ready to move on to something else. And at that point, here is your transition phrase. Guys, gals, this is the most important part of the entire presentation because, like I said earlier, the hardest part of a cross-sell is how do I go from the Medicare Advantage to presenting a different product. So I've got him sold, or I'm reviewing his current plan that he already has, and I simply say to him, and you can make this your own, you can put your own language in there, this is just mine. I simply say, well, Mr. Jones, when we first started selling Medicare Advantage plans back in 2005, with an effective date of January the 1st, 2006, no one, including myself, knew how benefits would be paid out. It was a new program. What we found after a couple of years, we were noticing that the clients that we had with our company were paying a lot of money out of their pockets when certain scenarios took place. Let me just ask you a couple of quick questions. Mr. Jones, have you ever been in an ambulance? Guys, it doesn't matter if he says yes or no, your response is virtually the same. If he says yes, you simply say, well, Mr. Jones, where did the ambulance take you? If he says no, you would simply say, Mr. Jones, if you were in an ambulance, where would that ambulance take you? And I challenge you guys to ask somebody that question. Ask them if they've ever been in an ambulance, and when they say yes, we'll say, well, where did the ambulance take you? They will invariably say, to the hospital. And at that point, I would say, well, yeah, I understand, to the hospital. I said, but what part of that hospital? And at that point, they say, well, they'll take you to the emergency room. And I'll say, that's right. I said, Mr. Jones, now what happened is you just triggered 2 co-payments of your Medicare Advantage plan, and I point back to the $150 and the $65 on the legal pad. I said, now, Mr. Jones, one of 2 things is going to happen while you're in the emergency room. First off, they could possibly stabilize you and send you home, or what else? That can't, I'm asking them a question. I've already eliminated the first scenario. They're going to fix you up, say there's no problem, going to send you home. At that point, he will say, well, imagine they're going to put me in a hospital. And I'll say, well, that's exactly right. They're going to admit you to the hospital. And now, Mr. Jones, that's going to explain, or that's going to trigger one of the most expensive parts of this Medicare Advantage plan. That's going to cost you the $250 for each day you're there. So I've solved the scenario that this plan covers. And at that point, he is now wanting to know what this is going to cost him. So you remember the Secure Advantage brochure is on the first, this is talking about the silver benefits you see up there in the upper right-hand corner where it says monthly bank draft premium, silver level. On the other side of this brochure is the benefits of the program, and on the flip side is your rates. It's a very simply put program that you can price immediately. So if I knew he was paying $450 a month for a major medical at 64 and getting ready to turn on 65, do I walk away from, if I put him on a 0 premium MA plan, do I walk away from that? Or do I explain to him that there's co-payments and deductibles and start working it into his budget and pick up maybe 50, 60 bucks and help myself provide for my family? So at that point, once I turn this over, I just simply say, well, Mr. Jones, that's why we created this program. Now, when I say we, that means us, the insurance company. You can simply change that to your own writing, your own language. Say, well, Mr. Jones, that's why the insurance company created this program. And you flip it over and you start working it into this guy's budget. If you do it this way, I think you guys will find that you will add this to about 6 out of 10, maybe 7 out of 10 people that you talk to. And if you are writing a lot of Medicare Advantage, or if you're out there talking to people that have Medicare Advantage, you'll pick up 2 or 3 of these easily a week. And guys, remember that example. 2 of these a week will put about another $45,000 into your benefit, or into your bottom line at your agency. So one of the reasons that this is important to you as an agent, and to me as an agent, is in the senior market on the health side, they have continually whacked our income in half. Back when I first started selling Medicare supplements, we were getting 60 and 70% to sell a Medicare supplement. Now we're getting anywhere from 15 to 20, 21%. So again, they cut our ability to continue to make a living. What happened to Medicare Advantage after it had been on the market for a couple of years? Didn't matter if you wrote somebody who had a Medicare Advantage or somebody who had a Medicare Advantage that liked yours better, you got paid a level comp. Well, now, if they have never had a Medicare Advantage, you may get, I think the street on most MA plans is 400, but if you're replacing that, you only get 200. So they cut your income in half on your replacement sales. By studying this product, practicing this presentation, if you guys will do this, you can take that 200 replacement sale and walk out of there with about a $600 commission, which is better than even if it was a first year. If it's first year and you add this on there, you can walk out there $700-800 in one sale. Take that times a husband and wife, you know, you're looking at $1,400 to $1,500, $1,600 commission. So I love helping people learn how to sell this. You know, the presentation is one I created. I've used it. I still use it. It works. I'm here to tell you it works. But it doesn't work if you don't use it. So if I can help you in any way, feel free to call on me at any time. Again, here are the states that this product is available. If you don't see a green state on where you're listening from or where you market to, get a hold of us after this webinar. We will make sure that you have that information readily available because we do have it on our sister company's paper of Equitable Life and Casualty. We are also on the 17th of June getting ready to introduce a brand new final expense plan that's going to have extremely good comp, going to be very liberal in the underwriting, and very good rates. So we're doing a lot of things here between Heartland and our sister company Equitable, to where if a client wants a Medicare supplement, you can reach into your client and pull out the just introduced in February Medicare supplement product. It's in 44 states, not quite approved. I think it's approved in about 40 right now. If they want a final expense plan, you can reach in and pull out our new program on the 17th of this month. If they want a short-term care plan, Equitable's got one of the best ones on the market. If they want a Secure Advantage, we have that. If they want a standalone cancer plan, we have that. So we're trying to give you, the agent, a way to make a lot of money with Equitable and Heartland. We have been doing this a long time. I've been working with both of these, well, not with both, but with Equitable since 1989. One of the best TPA platforms that I've ever done business with. They're very agent friendly, and they are also our TPA for all of our products. So with that said, guys, gals, I'm going to shut up and let Rashawn get on here. If there's any questions that she hasn't answered, she'll read them back, and then we will let you get on with your day. Rashawn?
I am on here. Okay. Okay. Hold on just a minute. I was reading.
Rashawn, I can't hardly hear you at all.
Okay.
And I got hearing aids.
What about now? Is that better?
That's better.
Okay. The first question I have is, I have a client with type 2 diabetic and is no longer a type 2 diabetic and takes no medication for the last 2 years. Would they decline if submitted? Would they be declined?
Only if she's taken over 50 units of insulin. If she's not taking over 50 units of insulin, you can send that in, and as long as, now let me back up, as long as she doesn't have any complications of diabetes such as neuropathy or retinopathy or kidney damage. So, you know, that I can't give you a direct answer on that, but if she's under 50 units of insulin and no complications, yes, definitely we will accept that.
Okay. The next question I have is, can we sell this product outside of the open enrollment period?
Very, very good question. Yes, you can sell it year-round.
Okay.
Matter of fact, what we have a lot of guys do that are really heavily involved in Medicare Advantage and just don't have enough time maybe to do it at that point, they let their client know that they will see them after the December the 7th date because there's other things that they want to discuss with them. And by the way, you do not have to have a new scope of appointment form in that situation for the simple reason that scope is good for 6 months with your existing clientele.
Okay.
So a lot of guys will go back. I got a guy over in St. Louis that writes 7 or 8 of these a week. He's made over $70,000 this year just selling this one plan alone.
Okay. The next question I have is, if they are going in to just discuss the Secure Advantage product, do they need a scope of appointment?
Say that again. Again, you're fading out on me real bad.
Okay, I'm sorry about that. If they are going in to just discuss the Secure Advantage product, do they need the scope of appointment?
No, if you're just selling scope or the Secure Advantage plan, you do not have to have a scope of appointment for this product.
Okay. The next question I have is, what is the minimum age that we can sell this product?
On Equitable, if you're using Equitable paper, it's 45 to, I think, 85. On Heartland, it's 18 and up. I've got it right here. Hang on, let me show you exact. On Heartland, it's 18 to 85.
Okay. And the last question I had, I got this several times. They wanted to know, do we have any plans to make this particular product an e-app where it can be done online?
Good question. We are considering that. Right now we've got so many different things on the plate. As far as the compliance department, we got a lot of jobs that they're working on, and that is something that the IT department is looking at. We get requests for that. So not yet, but I do believe that that's coming down the pipeline.
Okay, that was actually the last question that we had.
All right, well, guys, gals, thanks for joining us. Again, you've got my email address. You've got Rashawn's email address. If you need supplies, Amber can get those out to you. You can also go online at www.heartlandagent.com, and that's a secure agent website. Once you get your password set up, you can go on there and order supplies. You can, if you needed a brochure or anything like that, you can print that right off there if you needed it for like a quick sale and didn't have time to wait on supplies to get to you. So the website is really a really good tool. I had a lady at the event that we were at last week tell me that she tracks all of her clients' claims on there. So when they have a big claim, she picks up the phone and just touches base with them and said, a lot of websites don't have that feature on it, so you can track commissions, you can track pending policies, or if there's a requirement, it's on there. You can upload the apps to us on there. There's an upload feature button on there. A very, very good agent website. If you're selling MedSup, you can go, there's a comparison tool to where you can compare rates for different companies. Just a whole lot of information on our website that's very agent friendly, and when I say agent friendly, if a dumb old country boy like myself can do it, I know most of you guys can too. So anyway, thanks for joining us, and we will talk to you soon. We do appreciate you, and if you have any questions, feel free to contact us at any time. Thanks. Have a great day. We'll talk to you soon. Bye.